Can I
Okay, is it time to
jump us to our next scene? We're going to skip over scene 3, which was the team meeting worksheet. What happened in the story is that Jan started to improve. She was taking her medication. She's starting to get a new confidence and feeling really good. And she also started missing some of her appointments. And then, eventually, she stopped coming altogether. So Craig is keeping track of his clients, and he gets together collectively with his colleagues, and they talk about, what's going on, and sort of go through some ideas. What happened the last time you saw her? Have you tried this? Have you tried that? The purpose of this sheet is just to keep track of everybody. It's your list when you sit down in your group and take notes. That's the purpose. So Craig takes some ideas from that group meeting. He gets in touch with Janet. She comes in, and he assesses her. And what we want to make sure we cover today, because this is one of our most favorite sheets, is the vital sign worksheet. This is a visual for not only for Craig, but it's going to be a visual for Janet. It's going to be a visual to sort of chart. It's like, have you ever seen on a medical record where you chart vital signs, the temperature, the pulse, the blood pressure, and you can see the trends? This is a trend sheet. So he can see, oh wow, she's complying with her medications, she's going to therapy, her PHQ score is looking better, oh, she's dropped off taking her medications, her PHQ score is going down. So this scene opens up with Janet and Craig, and he's going to show her the visual of the vital sign worksheet after he's reassessed her PHQ-9. So we'll start with that. You've reassessed the PHQ-9.
So I've been missing some appointments and
You've
stuff
missed,
like that.
and then you guys connected on the phone.
And we're back.
And
Right.
she's agreed to come in and just talk.
Right, so we're talking.
And now he's assessed your PHQ-9
So you can
score,
see
and
why
he's
I'm
ready to
missing
show this.
Hey, welcome back, stranger.
How you doing?
Oh, it's been a long time no see. Where you been?
Oh, everything's been great. I've been doing, been working and taking care. I've been feeling really good. I've been feeling really good.
How come you haven't been coming in?
Because I really don't know that. I don't really think I need it that much anymore.
Okay. Have you been taking your medicine?
Sometimes. Not as much as I used to.
Come on now. How's your drinking?
Actually, I stopped drinking. I stopped
Good.
drinking. I started going to some other groups.
Good.
So I stopped
Good.
drinking.
All right. How's your sleep?
Sleeping's good.
Sleeping's good. I want to share something with you. If you notice when you came in, you were here. You started at a 24,
Mm-hmm.
right?
Mm-hmm.
So then 2 weeks later, you were feeling a little better. You were still high, but you were moving up.
Mm-hmm.
Okay? 3 weeks later, you were all the way down to moderate depression. 2 weeks after that, you were down registering in the minimal depression. Good job. But then you quit taking your medicine, and you quit coming, and you started going back, creeping back up again.
Oh.
So I want you to be aware of that. Because we want you, I want you to look at this.
So am I going to have to do this forever, though? I mean, is it ever going to stop?
You don't ever have to do anything forever. But we gotta get you well. Okay? Hasn't even been 6 months yet. And you can see how much progress you've made, but then you started feeling better. Because, when we start feeling better, we don't need it anymore. You started feeling down again.
I think I started. Yeah, I stopped doing a lot of the things that I was doing. I did stop doing some of the things. Cause I remember that date. I remember when I came in that time. I was feeling really good that day. Yeah, I don't want to get back to. I don't want to go back here.
You don't want to go back here.
I never want to go back there. So what do I got to do, though?
Well, we got to get back to your personal wellness plan. I need you to make sure that you're still doing those sorts of things. Making sure you reach out to your groups, your friends, do your exercise. Make sure you have time for me. I need you to make sure that you talk to the doctor and discuss whether or not medication is still the best option for you. And if it is,
So cause sometimes right now, really honest to goodness, I don't feel like I need that medication no more.
I know. But that's something that I want you two to talk about. Okay? I want you two to talk about. Because maybe that's you'll come to the
Can
conclusion.
they lower it or something?
You talk. Where's your little book?
Oh, I forgot it.
Okay. So we got 3 questions. We're going to write down on this piece of paper for you, and I want you to ask the doctor about it.
Okay.
Okay? So those are the things that you need to sort of do to get back to feeling good. Okay?
One of the things that I like about this form, and if you work in recovery or if you're working around, like a population is moving around or not, this really helps the person be able to visually see how they're doing. Like if you put the date at the top, when they came in, how they were doing on that PHQ-9, or even you have notes and you wrote down, like, you know, depending on your style, you were really high. And I remember one thing that you did that day, or you've been doing, and then I noticed that you stopped doing these things. Like you stopped doing your affirmation in the morning. You stopped, you know, you can show them where they started to decline. And then they can say, oh, you know what, maybe I need to start going back and listening to my morning songs again. Or maybe I need to do, you can help them identify again where they started. Because most people that start medication or in recovery, they go full force because they're right here, right in the midst of it. And they start out, and you see people going to meetings all the time, or they're coming to see you all the time. Then all of a sudden, when they are at their best again, they don't need you anymore. And then that's when they stop going, and they go back down, and then you see them again, because they're back at 0.0 again. And then you got to chart back up this. What you want to do is you want to catch them somewhere in midstream before they hit the bottom. This chart helps you chart them and help them see where they're going. So that's the wonderful thing about this. I really like this one. I don't know if you guys like it, but so just to ask you, do you think you could use something like that? Yes?
That way, that the person will know, you know, like you started here, you were doing this, and they could see it in paper.
Right.
Like something that, you know, they could see.
Exactly.
They say, oh, wait a minute, yeah. And then maybe they pick up and start doing the stuff that they were doing. So, because I guess, you know, nobody wants to be depressed.
Nobody wants to be depressed. Thank you for coming to our workshop.